Everybody hears about cholesterol. Tell me about total cholesterol and how the cholesterol is broken down, which one's bad, which one's good.
Yeah, total cholesterol is made up of lots of different particles. So you have the good cholesterol, which is the HDL, the bad cholesterol, which is the LDL. And I think about it as the LDL is the cholesterol that goes from the liver out to your arteries and causes damage. HDL is the cholesterol that goes from your arteries back to the liver where it needs to belong and be metabolized.
So why do we call the HDL good cholesterol? What does it do to be good?
It helps clean up your arteries. So the higher HDL you have, number one, you have a lower risk of heart attack, but two, it reduces the amount of plaque that we see and reduces the amount of inflammation in the arteries the higher that number is.
What can we do to raise the HDL? That's been one of the hard things in medicine.
It has. And there's a difference between just making your labs look pretty. So there have been drugs historically like niacin or niaspan, except with the introduction of statins, there's no benefit to heart attack prevention. The natural way to do it is with exercise or mild alcohol consumption will also raise your HDL.
So exercise is a good way to raise your HDL. How many points can you get with regular exercise?
I would say more than likely you probably only get 5 to 10 points with a complete diet modification and exercise.
So let's talk about the LDL. I call it the lousy cholesterol. The LDL is the one that does what as far as the blood vessels go?
So the LDL, there are actually 9 to 10 different particle sizes of LDL in and of itself, so it can get really complicated. There are all these tiny little particles go on the walls of the arteries and start to occlude it, and when they get occluded, that's when we get those symptoms of angina or chest pain.
You occlude the blood vessel, you're talking about the coronary vessel.
Exactly.
What does the coronary vessel do to the heart? I think some people really don't know that.
Yeah, now the coronary arteries are the only blood supply. It's the sprinkler system for the heart. And so
that's a good description. I like that.
When the sprinkler system gets blocked up, the grass doesn't like it. And so that angina pain, and angina is a fancy term for you're getting pain in your heart muscle because there's not enough oxygen. And those type symptoms typically occur when the heart has to work harder. You exercise, you exert yourself.
So the LDL will deposit in the coronary arteries, will narrow them with a plaque, or suddenly it breaks loose and you've got like an airbag that blocks it?
Yeah, both things happen. Most patients who have symptoms with heart attacks, usually it's a plaque rupture that causes the heart attack. Only about 20 to 30% of heart attack have this gradual or progressive narrowing of the artery that finally becomes significant.